Welcome, everyone. Thank you for joining us in coming together for safe and respectful maternal and newborn healthcare in prisons and refugee camps. It's hosted by the International Alliance of Patients Organization. My name is Rachel, and I'll be your technical facilitator. So if you have any issues, please contact me via the chat function, and I'd be happy to help you with your Zoom. Before we get started, I'd just like to mention that if you have any questions that you'd like to ask, please use the Q&A box, which you can find at the bottom of your Zoom window. And just to highlight that this session will be recorded for documentation purposes, and we're going to share the recording hopefully tomorrow. I will now pass the floor to Kawaldip Sehmi, CEO of IAPO. Kawaldip, the floor is yours.
Thank you very much, everybody, for joining us on this very important occasion. As you know, on the 17th, tomorrow, the World Health Organization will be marking the World Patient Safety Day. And the main theme selected for this Patient Safety Day has been looking at safe and respectful maternal and newborn care. We thought it would be very good to assemble a program here where we will bring in some of the mindsets that have really worked hard over the years in developing that safe and respectful maternal and newborn care. Joining me today, firstly, will be Honorable Penilla Gunther, who comes former Member of Parliament for Sweden and founder of FOKUS, the Swedish patient safety and a patient safety patient safety expert herself. Penilla has been an MP in Sweden for 8 years and has numerous positions in both politics and companies and organizations. And she has been part of that shaping of maternal and newborn care legislation, policy, and process in Sweden. It is something that's very important to her as well. She really likes it. And you can see from her voice as she speaks, it comes through, and has really, I think it's legislators like her that have made Sweden the envy, I would, not in a better envy of the world, in that you have best maternal health care and postpartum, prepartum, a whole lot. And for that, it makes absolutely wonderful to see you. Then the other speaker with me is Lars Klingsbo. And that's something else Sweden has been very good in. I think that's international development. You've got people in Sweden, more per mile and per square mile or per square kilometer in Sweden than anywhere else, who are engaged in global international development somewhere. Last check by UNICEF, which is the United Nations Economic, Social, and Cultural Committee, and also UNESCO revealed that Swedes are more likely to be members of some community of practice than the rest of us. They are so civil society minded, and they bring it in. And Lars has brought a simple invention to the world, and it is a motorbike ambulance. Something that we saw 10 years ago. A lot of motorcycle taxis started in globally, and boda, as we call in Uganda, in Kenya, where I was born, brought up same thing. And Lars combined the two and brought that ambulance. And you will see a demo of his excellent quality of bike. And it's so safe and it's so respectful. I think that's what I like, respectful. It was a biker. It wasn't a woman being picked up and dropped into a rickshaw and ridden. It will be a woman who's comfortably seated and can travel. So without much ado, I would ask Penilla to start us off. Penilla, please share with us, how did Sweden get to where it is, and what would you recommend the world do with it?
Thank you. Thank you for the introduction. And I will warn you, all the audience, because I'm quite boring, by starting with some examples from Sweden social security system. And I would like to share some slides with you about that. But the examples are carefully really I hope at least that they will show the importance of a stable social security system to really enable a child to have a safe upbringing and also to have a safe childbirth in all countries. And at least I used to say that the Swedish system might not be perfect, but it's quite all right. So hopefully you will agree with me when I'm sharing my slides now. And I don't know if you should help me, Rachel, or if I can share it myself.
I think you can go ahead and share it yourself.
Okay, yeah. So, as I was introduced, I'm a former member of Swedish Parliament, and now I have been one of the founders of FOKUS Patient, an initiative who are really bringing life science and healthcare together, and with also a patient perspective. And that's why we are really trying to promote patients' rights, and patient safety is one of them who are really important all over the world. This is, of course, my beautiful grandchild, Henry, who is now 1.5 years old, and his mother, Malin, just beside him. And I would like to really take them as a good example for a safe childbirth and maternity care in Sweden, and I will come back to that later. See if I can change also slides. Yes. And as I said, it might not be perfect in Sweden, but it's quite all right. And I think it's all right because we have so many opportunities in Sweden who are not really enabled in the rest of the world for parents to really be able to show their children that they care about them, because they can be at home with a newborn child for quite many days. As you see here, it's parental benefit paid out for 480 days. And I think that is one of the most generous paid leave in the world. And you also get 10 days paid when you give birth to a child, and it's also for the other parents. You can really be able to share the care of the newborn child at home. You can also, of course, before the child is born, you can be sick. Anyone who has been pregnant know about backache or anything that can happen, because you have also a working environment that is maybe not so good for you as a pregnant woman, and then you can also be home with some paid leave. So you have some pregnancy benefits also for that, which I think is crucial when you are going to have a safe delivery. The child allowance that is equal for anyone in Sweden, it's paid out whether you are a millionaire or if you are a poor paid worker. It's 125 euros monthly. And if you have more than one children, you can have also an addition, a supplement of 15 euros per child per month. And one thing that is very common in Sweden in these days, in September, October, and in February, is really the use of the benefit of care of a sick child, usually called VAB. And also, well, of course, because nearly any child in Sweden are going to preschools and have their annual infections and and flus. So any family in Sweden are very familiar with these benefits. And if you have a child who has got a disability, you are also able to get some assistance or special benefits paid out for being able to take care of your child. Many of the benefits are depending on your annual income. So of course you can have quite low amounts of benefits, but anyway they are there as a part of the social security system. And one thing that is quite important in Sweden is the equal share of parental leave. And in 2019 the fathers reached finally at least 30% of the days together who has been paid out for parental leave. So of course 70% of the parental leave are still taking out of women, the mothers. But anyway, it's quite common, and I know there was an international newspaper some years ago who made a very, very big article about the Swedish home dads who are out with their strollers and taking some coffees out in the parks with their babies. So it's not any unusual to see newborns with their dads on the streets, and I personally think it's very, very good, because I do think any child benefit from the caring and sharing between parents of well, any daycare. So I think that is going at least in the right direction. But there are not only the parents' rights for the children, it's also the children's rights to their parents. And one thing that we are very good at in Sweden is to have ombudsmen. It's really a Swedish word, and we have it, we recognize it from the European Parliament or European Union. It's EU ombudsman. But we also have a certain barnombudsman in Sweden, children's ombudsman, to taking care of the rights of the child from the Convention, of course, of the rights of the child. So and it's an annual report. If the official agencies like communities, regions, or at the governmental level are really delivering children's rights or not. So it's a democracy issue in Sweden about children's rights. And there are also two other examples I would like to share with you, and that is the right for children to be informed about their parents' health conditions. So if you get a parent, I mean, if you as a parent have an injury or accident, a disease of some kind, and you are at hospital, and your child has got the right to be informed about your health condition. And it's also said in the law that the child should receive the information at suitable for their ages. Of course, you can say you cannot use difficult words to a very small child, but it can be tricky anyway to explain a physical or any other condition in healthcare for a child. But I think it's very good for them to have that kind of right. And I would like to take a personal example to show you just how important it is. I had a heart transplant 14 years ago, and my own children, I have 2 sons, they were teenagers at that time, and they were called to the hospital to be informed about their mother's condition and how the prognosis were, and what they could expect from my severe heart failure, and what could happen if I couldn't get a new heart, and how the process should be. And I think that really shows to me that it's so important for children to know. More information makes them also, you know, if they are informed, they can do what they can for their parent, and if they are not informed, they can also imagine things that will not happen. So I think that is quite a good legislation. There is also one other example I would like to mention about legal representatives for children to act instead of a child's caregiver, to take advantage of the child's rights before and during a process in court. And of course, you can say that it's mostly used when parents do not agree about taking care of 1 or 2 or more children within a divorce. But it's also about, you know, crimes committed to children, and maybe the parents are not suitable to really represent their own child. So I think this is quite good, and it's what's regulated already in Swedish law in 1997. One thing that was raised also in the program was the healthcare rights when you are migrant or refugee. And in Sweden, you really have just 2 levels, I would say, or it's divided in 2 parts maybe. When you seek asylum in Sweden, you are entitled to emergency healthcare and dental care and healthcare that cannot wait, and it's the same for the European Union. But you're also entitled to childbirth care, abortion care, advice on contraception, maternity care, and so on. And that's really on the same conditions that you have as a Swedish citizen. And also persons with a residence permit are entitled to have the equal rights as a Swedish citizen in these matters. So it's not that difficult to understand, I think, when you arrive to Sweden, what kind of rights you have. And parents in prison. The first slides were shown about the benefits you have as a parent. And of course, it does not stop because you are a parent in prison. But it's of course special conditions for a child to have a parent which you cannot meet anytime you like to. And there are, in Sweden at least, 30,000 children who have a parent in prison or at probation. And as I mentioned about the information for children with parents in healthcare situations and the need of information, it's the same here for children who are having parents in prison. They need to be informed about what has happened, can it happen again, why are they there, what will happen after they get out of prison, and so on. So I think there is a lot of work going on in Sweden. It's not perfect this either, but it's quite good, at least that it's recognized by the National Board of Health and Welfare. So they are eager to really reach these children, and of course to reach also the parents who are in prison and longing for their children. And they can provide parents in prison with parents groups. I mean, maybe some of them have really never met their children because they have been in prison so long. So when they finally are getting out of there, they don't know their children very much, and certainly not know how to take care of them. So it's quite important with these parents groups. One thing that I think is quite unusual, I guess, I don't know, but they can record when they are reading good night stories for the children on tapes or in a CD or whatever, for the children to recognize their voices. And of course, they are trying to have children-friendly visitors rooms. But when you become a mother in prison, and I will finish with that, you can of course have a baby in prison and keep it there for a while if it's the best for the child to do so. And it's mostly accepted if you are going to be there for a short period of time. But then otherwise it will be sent to a family home, as we call it in Sweden, for a while at least, to make sure that the parent will get on her feet when she get out of prison and she is really able to take care of her child. But as I started with the slides of the benefits, as I said, I think at least you have some good economic and stable conditions in Sweden to really give birth in a safe way, and you can also at least have a good life because you have a social security system that will support you. But you can never take away the need of other persons and organizations who will support you, of course. So I would end this short presentation by saying that patient safety is important wherever you are, and whether you are in prison, you are an ordinary parent just trying to make your best for your children, or wherever you are. But patient safety is so important, and I do believe that a social security system can at least provide the framework for that. So I will end there, and thank you for listening.
Thank you very much, Penilla. It was excellent. I think, as you said, a series of things are done. You repeatedly do things and you consolidate and bring them up. And by the time the woman does go to either a prison hospital or to normal maternity, she's assured that she's going to be taken care of, her children are going to be taken care of. And when you go into childbirth with good mental health and well-being, you actually come up with better outcomes. Now, little things matter. I think the next speaker for us, I think Lars Klingsbo. I was so impressed with his motorbike ambulance when we met in Uganda about 2 years ago. And I saw these little pictures of it everywhere. And I could see it was delivering women who were pregnant with their kids, all the hospital bag and everything. And I liked it so much. I always kept in mind, I didn't know who it was who had started this, and until Penilla and I were having a discussion about a year ago about World Patient Safety Day, and she mentioned her very good friend Lars was part of us. So I must have Lars to speak for us. Lars, over to you. Please show us how this works, a demonstration. We are going to do something very experimental here. Let the product speak for itself. It's a respectful way of bringing a woman into hospital. It has got 1 year's, what we call the golden hour. Within an hour, you can get to health care, especially when you've got breech birth or you think there's going to be liable injury. Then you must make sure that both the mother is safe and gets to healthcare within the hour, that golden hour, and can be seen to. Lars, to you now.
Thank you so much. And I'm actually sitting in my greenhouse because I need to be a little bit outdoors. So it's 8 degrees here in Sweden, and it's a little bit chilly. And thank you, Penilla, for your presentation. I learned actually a lot of what's happening here. It was a while since I became a father myself, so it's very interesting to hear. I want to share with you about something that we call the EEZER initiative. And first, my name is Lars, and I've been working for a faith-based organization for 14, 15 years in advocacy and in about 35 countries in the world. And I have seen and heard so many stories during my travels about, especially in the case when it comes to FGM, the female genital mutilation, especially in Kenya, southern Kenya. To hear the stories about the women, or actually the girls, because most of them are very young. To hear stories about teenage girls that are, due to complications with FGM, they give birth at home, and when they have complications, they are not able to get to the clinics in time. And me, I'm not a doctor. I'm some kind of a communications person, but I'm also a motorcycle rider, and I love to ride motorcycles in Africa. So we started to think together with some entrepreneur friends, also bike riders. We started to think, if this is such a huge problem to just the transport, I mean, we should be able to contribute somehow to solve this challenge. Especially, I mean, we say that Africa is not a country, but there are so many things that are similar all over Africa, especially on the countryside. And access to healthcare is the same all over Africa. And I saw there was somebody from Nepal here as well. Same thing in so many places. The transportation is a bottleneck for women's health. So actually, I'm gonna go outside my chicken pen and greenhouse to show you what we did. Let me just walk you through my garden. So down here you can see there's quite a small motorcycle. It's a 250cc motorcycle, and beside it we have this little trailer. It's like a sun chair on wheels, very comfortable to sit in actually, and it's made with local materials that can be found like anywhere. It's the front wheels from this Indian or Chinese motorcycles. It's the suspension and all these parts. Most of these parts can be found locally, and we have now we have been working with this for 4 or 5 years, and it has been mainly volunteers, and some engineering companies who has done this contributed from a CSR perspective, but the rest of us are volunteers, and we have built. In a pilot phase, we have maybe 30-40 of them in different countries, and we have actually seen, now we're getting confidence that the technical solution is working. It's relatively
Yes, I think Lars is frozen. Is that correct? Yeah. Go on, Lars. But back, you're open again. Yeah. Oh, it's frozen again. Lars, we've lost you. Okay. What we will do is when he comes back.
well. Sorry.
Go on. We lost you a little. Go on.
Oh, sorry. Yes, we are confident that we are also solving the operational parts. So now we are then what we are doing now. The big thing for us now is Burundi. Our partner organization in Burundi. They have 33 clinics, and they help in assisting 11,000 deliveries in a year. Now I'll give you some math to think about. 11,000 deliveries, and WHO they recommend that you should go 7 times to a clinic for each delivery. So that's 4 times before delivery, then you go for the delivery, and 2 times after. So that's 7 times, and back and forth, that's 14 trips. 14 trips times 11,000, 154,000 trips in a year, just to that the women have to do just to get to access healthcare. And today, I would say 99% of these 11,000 women, they would walk in Burundi. And for the first checkup, that might be okay. Maybe for the second checkup, but after that, it's starting to get heavy to walk maybe 10 kilometers to a clinic for a checkup. So the need of safe and cheap transports is huge, and it does make a difference. We went 2 weeks ago. We went to Burundi because we have 2 units there already in a pilot study, and we went to check up. We kind of lost connection during COVID, but now we are back on track with them again. And of course, there is proof of concept. I mean, we met young girls that they carried them by stretchers to the clinic, and she was not really, she was in a bad condition, this girl that we met. They carried her by a stretcher to the clinic because she lived quite close, but at the clinic they discovered that this is very bad. She needs a cesarean section, which is next hospital is 17 kilometers away. That's not so far, but and very bad roads. But within an hour with the motorcycle ambulance, she was there and she had the C-section, and she survived. It was not a comfortable ride at all because it's harsh, but she made it, and she's alive and the baby's alive. So we do have proof of actually the transport is crucial to save lives. But we also believe that it's not the emergencies that is the main thing. It's the checkups before to see what kind of problems the mother might have at an early stage. That is really saving lives, that they access healthcare ahead of the delivery. So this is a little bit of what we are trying to do, and I don't know what kind of crowd we have in here, but I see some popping up here. There are people from Nepal and somebody from Uganda. I saw, and of course we are looking for partnerships with the organizations that are working with healthcare on the ground, especially in East Central Africa. So if you do want to connect with us, I'm very high tech today. There's no PowerPoint presentations, but I'll give you, if you can see my email address here, info@eezer.org. And you can check us out on EEZER as well. EEZER actually means helper. So I want to thank you for taking time to listen to us, and I'll hand over to you.
Thank you very much, Lars. We will present all your information on our website and elsewhere, and I think we will share that with everybody. And thank you very much. I think you've presented some very good ideas, especially with FGM.
Yeah.
When you've got that, I think C-sections are more common, and I think other birth canal injuries are very common, and I think that 1 hour access is absolutely important. I've seen that, witnessed that, fistulas as well. Hamilton Trust who are a very nice couple in Ethiopia, fistula.org. Have a look at that. They really would benefit from this. We will talk to them later on. I think it's something we could work on.
Yeah.
Now, over to the next circumstances. I'll present that, and it's my pleasure to talk to you about this issue. I, as you know, previously had been working with Quorum Children's Legal Center and also in low and middle income countries in looking at health inequalities, accessible, etc. And one area I really worked was in prisons and refugee camps. And I always was absolutely shocked and horrified with the way pregnant women were treated. They were victims in themselves, and there was no underlying support there. And in prisons, especially being a lawyer, I used to say that one of the best things we could do to improve patient safety or mothers and newborn care was actually give them better legal representation so that they don't end up in the prison first. There are ways to work with the judiciary and try to get sentences that are more appropriate and community-based. So I will share with you what I've learned over the years. And for this Global Patient Safety Day, we would like to see that encompassed in our health systems and in our health policy globally. Okay. I'll start off by saying that we are looking at respectful birth and safe newborn and mother care. It's important to us that maternal care should be there. We are also looking at other areas for this, and we're saying that please do register tomorrow for this great event that's happening. And lastly, just to say that in prisons, one of the most important things that we have to do and undertake is to ensure that the maternal health care support is available. You ensure that the lawyers are there at a pre-event. Make sure that the lawyer supports the mother. Mother is then incorporated within the health system and make sure that's taken care of. We then looked at refugee camps, and this is again one of the things we've realized that very often we don't know how many there are. This is something that keeps on coming from various other aspects. We have been told that we don't know where they are, what state they are, and if you don't count, if you're not counted, then you don't count as the same. But to back to my presentation, so we can say, so remember that tomorrow is the big day, which is the World Patient Safety Day. Please register. We'll send you the links to that. Richard, do send them in the chat. It's free registration. Join us there. We are going to be working on something called the Global Patient Safety Action Plan 2021-2030 towards eliminating avoidable harm in healthcare. This was passed through tremendous work and support from patients and patient organizations at the 72nd World Health Assembly. Through that resolution, we got the World Patient Safety Day and also this action plan. And this action plan has been approved by all your countries. Yeah? Make sure this is implemented. And this action plan actually refers even to maternal and newborn care as well. You must look at that in thorough. We know that childbirth within these settings in prisons and refugee camps can be very high risk, disrespectful. That's why we have come to this, because our vision is to see patients at the center of healthcare throughout the world. And this means women who are pregnant as well, dictating how their health systems are oriented. And we want to build up patient-centered healthcare, and that is maternal and newborn care as well. Make sure the recipient is properly engaged and his or her needs are properly catered for. We've got about 297 members in 71 countries and about 51 odd disease areas. We have got members of members and huge networks, so we'll reach effectively, I think, We estimate maybe over 1 million patients globally. We're trying to empower patients. Then we try to drive research and then shape law and policy. And that's why I was so glad to have Penilla here today joining us, who has helped us into looking at how good maternal healthcare legislation, policy, and practice can look like. We know from WHO, as Lars had said, some of the stats is that the bulletin in 2015 was that 25 to 60,000 pregnant women incarcerated in prison. We can hope that lots of that incarceration actually begins with lack of access to good legal representation. It begins with that. One policy I always recommend over and above all is provide free quality legal advice and support to prevent that sentence into custodial sentence, change it to some community sentence, and it will improve society and everyone much better, improve the outcomes. The needs in prison are many. The women themselves are victims. I think this is something we forget. Many are young and they were in an abusive relationship, or they were empathic crimes, looking at either to drug use, abuse. And very often I found in Tajikistan, elsewhere, we had a situation where the judiciary was very biased. And I think even in India as well, caste and class, and you've seen horrendous films being made on this issue, where the judiciary is there, especially village councils, which have a very male-centric paternal view, and then they take some heavy sentencing, which is not within their jurisdiction. We know all pregnant women within prison services now suffer poor quality health care across the whole spectrum, which means essential services and even postpartum, which is rehabilitation. We know how disrespectful this births are. As we talked about Lars's bike, when I saw them in Uganda, it was so comfortable and respectful. The woman was in a joyful position, and that's how I wanted to go back home. She comes very joyful, bubbly. She goes back with the baby in the same way. I don't want her to go in hospital bed, or if worse still, in a coffin, because that's not why we're there for. In prison services, we are now seeing use of shackles, unsafe, unhygienic, very disrespectful. Antenatal and postnatal, perinatal is the critical one. I think this is when things do get in emergency in prisons, and then they don't know what to do. You have breech birth, you need C-section, and there's nobody available. Issue of low birth weights is very important for newborn care, because many of the women haven't had good nutrition due to alcohol and drug abuse. Fetal syndrome, alcohol fetal abuse, fetal syndrome comes in. Postpartum, I think, is a far worse thing, that we don't have any care. You have women who enter into postnatal depression very quickly and recover very slowly. And in prison isn't the best place to have it. That's why I said so it should be open prisons or some other centers. Now, prisons, women in refugee camps. This is working with UNHCR, and having worked in Dadaab, in border of Somalia and Kenya, having looked at in Tajikistan when the first Afghan war was going on. Can you imagine what a shame this has been? And then we saw what was going on there was, because nobody knew how many there were. So if they did not count them, therefore their opinion did not count. That's how it was. Many of the women were victims of violence, either through belligerent forces, what was called using force as rape as a war tool, humiliating others, or many were raped or became pregnant en route. And that was the double whammy. They were in strange lands with no care. Recently, we saw the Shamima Begum case in the UK about nationality, whatever the wrongs and rights of it. But the essential point was she had lost 3 children, 3 newborns in refugee camps and in transit. We know the disruption of healthcare is very common amongst women and their access to it. I think many countries are breaching Geneva Convention and other humanitarian law And we do have those instruments there. It's just a case of implementing them, having a strong body of patients, women in country, and making sure the refugee women are catered for. Let's take care of our neighbors. And who is our neighbor? Everybody now who is on transit or in refugee camp. My policy recommendation for this, having worked with this instrument for a long time and having been on the advisory board at one time, is that all belligerent parties, which is parties who are fighting together, or the host or transit country, must follow the sphere standards. These have set up the basic humanitarian standards. It's almost treating people human and making sure that we're treated with respect. And within it, we do have a large section on how to provide that pregnancy services and care, etc. Then going forward, it's very important for us to ensure that we keep on improving antenatal care in prisons and make sure that outcomes in all countries improve. We need to look at new strategies that have developed, especially in Development Goal 3 and 5, and to include that integrating vulnerable people into the developmental goals and services. The patient harm and theory and reporting metrics that we use elsewhere, we must apply to pregnancy and neonatal services. All national policies must improve reporting on sexual abuse and other human rights abuses. And we must look at WHO to help us improve that program. Most importantly, yesterday I was speaking on UN Women and the United Nations Development Program seminar for UN General Assembly, and we said we do need to build back better for the future. We must have a gender focus on our prisons, and we must encourage prenatal health education in all training facilities. And we look at this as a cost-effective solution for all. And with this short, I would say, please join us tomorrow again before we open the whole board for questions, and we can take it from there. Thank you very much, everybody. And I will take the questions now. One of the ones I think for Penilla was, what would you recommend a low and middle income country does for their health legislation or parliament? What would be a very good solution you could recommend for their legislators in low and middle income countries?
Well, I think it's so important to really try at least to erase the divided ranges of income. I mean, if you are poor or rich, it should not matter. You should have an equal right to basic health care. And of course, that is of great importance when you are giving birth to a child. You need to be as safe as anyone, because it's the most great moment of your life, maybe to have your first child, or any child you have in life, whether you have 7 or 18 or just one. It's the most important moment, and you should feel safe. And that is very depending today, I think, about what kind of income you have, and that it's I think anyone who is a leader or having the chance to really improve a health system, it's to really provide people with an equal health care. And I am so concerned that when I see healthcare systems all over the world who are not providing at least a basic health care equal for all. So when since I have seen the progress of the EEZER ambulances, for example, I think that is quite a good and easy example to show that you can provide a good service to mothers to be in a very, I mean, not affordable way. So you can at least try to make some steps for this to be able also for anyone to reach a hospital or some other kind of healthcare that you need in any situation of your life.
Good, thank you. Lars, for you, are you encouraging local manufacturers? How are you engaging them? I've got an email on this. Is there a way for joint ventures, etc.?
Yes, there are. I mean, our ambition is to be as close to the users as possible. So now after Corona, it's opening up a little bit for us to start some. We are starting up a workshop to build EEZERs in Burundi now, locally, the local workshop. We are starting up in Ethiopia and in Kenya. For Burundi, we are intending also to serve Eastern Congo and the Western Tanzania but we do encourage local production and cooperation.
Yes. And another one has asked, how easily are these ambulances maintained? Are you encouraging spare parts and things like that to be kept locally? What's a provision for that?
The most spare parts are from the regular small motorbikes that you see all over. So spare parts are easily available.
Okay.
It's the regular motorcycle spare parts.
And I will answer one myself here. I mean, yes, I think what the recommendation has been is to look at rights of the child and women in one envelope when it comes to a situation with pregnant women. So I do agree with you, clearly, yes, it is very important that the Convention on the Rights of the Child is actually married into the rights of women into that, and legislation should be. I think that's one recommendation I'm really agree on. That should be created. The other thing I've seen is one recommendation is that we should actually look at some of the good programs like Sure Start in UK, elsewhere, where a kind of a consolidated view has become from pregnancy to 5-year-old child going to school, having a central recording system and monitoring and managing, ensuring that all children born are healthy and fit and access education, and the mothers have got that support. We have got the last question here. Rachel, how are we doing for time?
We're very much on time. We have 5 more minutes.
Okay, thank you very much. Okay,
yes.
So what I'll do is I will just allow now Penilla to give us a closing summary. What should we be doing in the coming 10 years? We have got a World Global Patient Safety Action Plan 2021-2030, where we have to improve things in the universal health coverage we are going for. What should we be doing for maternal and newborn care for the next 10 years?
Well, I do think that every country should really follow the World Health Organization's patient safety plan. I mean, if they implement it really within their own legislation, and the healthcare system are really following the guidelines and the recommendations that are in the plan, or creating others together with examples from Europe or other areas in the world, no matter, but at least you should follow the World Health Organization's safety plan. And I think also patients' rights overall should be mentioned. Patient safety is one thing, and it contains so many areas, but patients' rights is also the right to be well well treated, and to have accessibility to health care, and so on. So there are so many things that are follow patient safety if you are really engaged to getting a better health care all over the world. So, but my recommendation is really to follow and to implement at least what has been agreed on international level.
I've got a very good message from one of our very strong patient advocate, Ofra Balban from Chen, which is a fertility association in Israel. And she says prevention, prevention, prevention. I think I like her approach to it. And Ofra, thank you for joining us. It's very good. I think you've suggested that for us. Now to Lars, one more suggestion for you, and then you can give your comments. Somebody said your bike should be included in the essential medicines and health devices list of the WHO. What do you think?
I think so, definitely. But you know, my main message is that there is one key thing that we need to do, all of us, and especially us men, and that is that we should. Maternal health is not a women's issue. It's something that concerns us all. So it has to be prioritized and brought up to a higher level, especially among us men. We need to take more responsibility in general. That is my main message to myself that I share to you guys.
Thank you very much, Lars. And I will just say that I will take what was said at the director of UN Women, Anita Bhatia, said is simply that, remember, with maternal and newborn care, it is 2 lives and the entire future of a country that you're putting at stake. And I think, count that out. There is no economic equation that can give you an answer. It's inestimable. It is, what is the value of that baby, you know? Tomorrow that baby could be a Nelson Mandela and transform your country's independence. It might be a scientist, you know, it could be the girl who turns out to be the scientist who found the vaccine for us at AstraZeneca. Or it could be a girl who's come up with beautiful music that inspires us all. So yes, I would say that this is an investment. Maternal and newborn care is actually investment, and a country that ignores it actually puts its own future in peril. And thank you very much, Penilla, for joining us, and Lars for sharing us that excellent ideas. And to all my colleagues who have joined us, and also everybody who's come in to support us during this webinar, please do join in tomorrow for that World Global Patient Safety Action Plan and World Global Patient Safety Day. Try to wear orange tomorrow because it's the color. And if you have influence over a building or a monument, please ask them to light that orange. Thank you very much, and have a safe day. And good morning, good evening, and good night wherever you are. Thank you.
Thank you.